Hi everyone, I'm Liang, and my presentation here is titled Lower Urinary Tract Symptoms and Medical History Helps Differentiation of Nocturia Aetiology. I have no relevant disclosures. Nocturia has varying etiology and accompanying symptoms and risk factors. It's currently unclear though what associated features are observed with which pathology. In particular, Detrusor underactivity, Detrusor overactivity, as well as bladder outlet obstruction. And so we hypothesize that clinical features may distinguish nocturia of different etiologies that are confirmed on urodynamics studies. And so the aim of this study was to characterize predictive features of Detrusor underactivity, Detrusor overactivity, and bladder outlet obstruction for males and females presenting with nocturia. And this is to aim to guide diagnosis and management. In terms of our methods, we utilized a retrospective study design analyzing consecutive patients that were referred for urodynamic studies at our single tertiary center, and this was examined over a 7-year period. In terms of inclusion and exclusion criteria, we studied adult males and females who presented with nocturia, and this was defined as being greater than or equal to 2 times per night. Exclusions primarily were those who had insufficient data for analysis. Regarding our data collection, we collected variables including age, past history, symptoms, as well as urodynamic study parameters. For our symptoms, we looked at not only the quantity of storage and voiding symptoms, but we also analyzed these just based on presence or absence of either storage or voiding symptoms. We also collected data on urodynamic study outcome findings, including Detrusor overactivity, underactivity, as well as bladder outlet obstruction. And these were determined based off the bladder contractility index, as well as the bladder outlet obstruction index, calculated from the urodynamic studies parameters. Regarding our data analysis, we compared Detrusor overactivity, underactivity, and bladder outlet obstruction against the baseline variables, and we also performed multivariable logistic regression to adjust for all of these covariates that we studied. We did this separately for males and females to look at the differing effects. Regarding our results, we had a total of 372 patients included, and this consisted of 213 females and 159 males. There were more men with Detrusor overactivity and bladder outlet obstruction compared to females. However, there was no difference identified in the proportion of males and females with Detrusor underactivity in our study population. We then performed analyses on women, starting with univariate analyses. Women who had Detrusor overactivity tended to have more storage symptoms than those without Detrusor overactivity. Looking at women with Detrusor underactivity, these women tended to be of older age, and there was a higher proportion with a neurogenic bladder history. There was also more concurrent voiding symptoms than those who did not have Detrusor underactivity. Finally, those with bladder outlet obstruction tended to have a high proportion with a history of diabetes, as well as having more voiding symptoms compared to those without bladder outlet obstruction. Multivariable logistic regression confirmed our findings from the univariate analyses. Predictive models are shown below. On the left, you can see that Detrusor overactivity is associated with an increasing number of storage symptoms. In the center, you can see that Detrusor underactivity is associated with increasing age. And finally, on the right, you can see that bladder outlet obstruction is associated with presence of voiding symptoms. We can then turn our attention to the analysis of men. Firstly, from the univariate analysis, men with Detrusor overactivity tended to have more concurrent storage symptoms and less concurrent voiding symptoms compared to those without overactivity. Those with underactivity tended to have less storage symptoms and more voiding symptoms. And finally, for those with bladder outlet obstruction, these patients tended to be of younger age. However, there was insufficient evidence for any association with storage or voiding symptoms. Similarly, multivariable logistic regression supported our univariate analyses. On the left, you can see that Detrusor overactivity associated with a decreasing number of voiding symptoms. Underactivity was associated with an increasing quantity of voiding symptoms. And finally, bladder outlet obstruction was associated with younger age. And our results therefore suggest that there is still considerable overlap in presence and absence of storage and voiding symptoms for Detrusor overactivity, underactivity, and bladder outlet obstruction for patients who present with nocturia. However, quantifying voiding and storage symptoms, their age, as well as select medical history may guide the diagnosis and management of patients who present with nocturia. Some limitations include the study design, for which we employed a retrospective observational approach. We did not analyze the severity of the symptoms that patients reported. And finally, in terms of the scoring for Detrusor underactivity and bladder outlet obstruction in women, we used the same measurements and cutoffs for bladder contractility index and bladder outlet obstruction index that would otherwise be used for male patients, and this may affect our findings for female patients. Thank you very much.